So, Dr. Bowden, you gave one of my favorite rounds this morning on the microbiome of the gut, right? And how it connects with your brain and all of the above. And so, first and foremost, what is the gut microbiome?
Excellent question. So basically, in our guts, we have all of these bacteria, billions of bacteria, and some of them are healthier and some of them are less healthy. But those bacteria play a big role in chronic disease and basically just how our body functions, which is pretty incredible that these tiny bacteria that just we used to think were freeloaders in our gut actually have a really big impact on our health.
That's cool. And what are some of the symptoms that we can recognize to know that our microbiome might be off?
Mostly think about the things that you would consider with anything else being wrong with your gut. So gasiness, nausea, pain, just constipation, diarrhea, kinds of, those things we don't really love to talk about.
But
all of those things
symptoms all lead back
symptoms.
to microbiome,
Right.
which is really cool.
And some people don't have symptoms, but they can still have a messed up microbiome.
Yeah.
And so that's where things get a little bit complicated, is you may have adapted to less healthy bacteria. And so when you introduce the healthier bacteria, sometimes you get the symptoms then.
Right. So talk to us about these different bacterias. There's probiotics and there's prebiotics. Can you tell us the difference?
So probiotics are the bacteria, and those are those healthy kinds of bacteria. Like, there's a variety of different ones. We won't go through all of the big names because nobody really cares. But those healthy bacteria that we get in our foods that have been fermented, basically. So kefir is my favorite, or kefir, depending on where you're from. Yogurt, kombucha, this fermented soy kinds of foods, fermented vegetables like sauerkraut or kimchi, or fermented pickles. All of those kinds of vegetables have those bacteria in them that are then healthy. Prebiotics are fibers. So the foods that we're eating that contain fiber, like fruits and vegetables and whole grains and nuts, even cocoa, have these fibers in them that those bacteria like to eat. And when we eat those foods, we're feeding those healthy bacteria, and then they can grow and help us. And it's a great positive relationship. On the flip side, things like sugar and those fatty fried foods are the kinds of foods that those bad bacteria like. And so when we're eating those kinds of foods, we're feeding those bacteria.
Interesting. And so with the gut microbiome, other than foods, what are some things that affect our gut?
So this is the tricky part. It's actually all of those great lifestyle things. And
wellness
think,
as a whole.
Yeah, they would affect us, but they
Yeah.
really affect those bacteria too.
Yeah.
So if we're not getting enough sleep, we're impacting those bacteria. If we're not getting enough exercise, we're impacting those bacteria. Unfortunately, as we get older, those bacteria are affected too.
Right.
And so we have to be extra careful
to take care of them. Yeah, absolutely. So it's food, but it's sleep, it's mental health, it's taking care of ourselves as we age. It's kind of all of the above.
Yeah.
But it really is one of the most important things when it comes to our health, which is really interesting. I think, as we learn more about the microbiome of our gut, all things kind of lead back to it, which is really interesting.
They do. And there's much we don't understand, but there's a lot we're learning.
Right.
And so we'll get there.
Our patients, where do we tell them to start? What's one thing that they can simply start doing to help their gut health in general?
So just start with one type of food that contains those probiotic bacteria that you like. So maybe it's yogurt. Start with that. And then start adding some of those other probiotic containing foods, and then start feeding them. So getting in more of those fruits and vegetables and whole grains, nuts, seeds, all of those foods that will help feed those good bacteria. And as we focus on those positives of, I want to get in these good bacteria, I want to get in these fibers that help feed these bacteria, it's a little easier to say no and displace some of those foods that are going to be less helpful for us.
Right, absolutely. Well, I could talk all day about food, especially food, but wellness in general. Good. And so thank you for being our wellness expert here at Summit. We really appreciate you, and thanks for great rounds.
Thanks, Amelia.